A liver kidney transplant obviously is the transplantation of two organs. The key here is having both the liver and the kidney go in safely and work. And the irony is that the liver and the kidney, while they're related to each other in terms of failure and they're reliant on each other, their management is actually very different. And so it really requires really expertise patient care afterwards. When our team recovers the liver, we're essentially cutting the liver out with scissors. And then there's a lot of extra tissue that's on the liver, and the blood vessels need to be prepared so that when we put the liver in the body, we're sewing the blood vessels and they're cleaned off, and the surgeon knows exactly where the blood vessels are, and they're not sewing in fat and things like that. So on the back table, for about 20 minutes, we're cleaning all the excess tissue around the liver and then preparing the blood vessels so that they're ready to be sewn in to the recipient's blood vessels, and it goes seamlessly. If the patient is doing well, we can actually put the kidney in at the same time. It's about an 8-9 hour operation. And the kidney goes in the pelvis, so the patient then has 3 kidneys. Or we can do what we commonly do and what we did in this case, where we put the liver in, make sure that she's doing okay, and then give her 8-10 hours to get better in the ICU, and then we bring her back and put the kidney in. A liver transplant is performed at academic health centers because it is the most onerous and resource-intensive operation that there is, in terms of needing the expertise and the multidisciplinary care that an academic health center requires. The liver controls so many parts of the body and does so many things, whether it's reliant on the heart, the lungs have to be healthy, the liver controls blood sugars, the liver controls nutrition, the liver controls protein consumption and generates protein, it absorbs fat. It does so many functions and is so integral to the body, like the heart, that it requires literally almost every discipline being involved that has some expertise in what organ failure is like, and then how to manage a patient that is under immunosuppression with a new organ and all the things that can happen. The condition that patients that need a liver transplant are in are usually they're dying. They're on death's door. If they're still at home, that means they're struggling. They're in and out of the hospital, or they're admitted to the hospital, which is most commonly the scenario when we do the transplant. And they have a risk of dying in the next 90 days. Typically, average for our center is on the neighborhood of 25 to 30% risk of dying. So it is a life or death aspect and a prospect for them. We have about 150 people that are involved in the whole process for one patient. That's a lot of resources, and that's a lot of care.